the views of the former Conservative MP who was in the House of Commons when he voted for those lockdowns, Sir Michael Fabricant. Good morning, Sir Michael.
Good morning. How are you, Mark?
I'm very well, and I will say that the COVID inquiry looks to be very politically motivated. You've got the Times newspaper, photograph of Boris Johnson. Inexcusable pandemic delays cost 23,000 lives. I will say that those figures are born out of junk modelling. That's an estimate as much as any of the others. And The Guardian, too little, too late. Tory response to COVID crisis damned in report. Boris has been thrown under the bus, Sir Michael. Is that fair?
I think that's a fair assumption. I actually think there's a huge amount of just hindsight in all of this. You've got to remember that when Boris, first of all, was faced and the government was faced with COVID, this had followed BSE, where we were all supposed to end up completely mad. Do you remember that?
Well, I do. I carried on eating burgers and I turned out all right. Look at me. I'm a picture of health, Sir Michael.
Exactly. And also, do you remember that there was bird flu? We were all going to be dying through birds or becoming birds or something.
Correct.
But the point is that this committee is working on the basis that we all knew what COVID was going to do. And of course we didn't. And there doesn't seem to be any sort of commendation for the fact that Britain came out with a vaccine program 6 months ahead of any other country in the world, apart from Israel. We were the only large country in the world and 6 months ahead of the European Union.
It was very effective rollout. Where I part company, though, with you, Sir Michael, is making healthy people have the jab, given that it didn't stop transmission.
Yeah, well, again, it was something we didn't know because doctors all thought, the scientists, the so-called experts, all thought that it would be like flu. And with flu, you cannot actually catch flu unless someone else has got the symptoms of flu. But we then found out, too late, that COVID could be transmitted even if you were asymptomatic. In other words, you had no symptoms at all of any COVID infection. Look, we were operating in the blind. And this committee, which is the most expensive committee ever formed, over £200 million so far. And don't forget, they're coming out with 10 different reports. This is only report number 2. It's going to go on and on. Mark, you and I will be dead and they'll still be sitting, this ruddy committee, and still be costing the taxpayer a huge amount of money.
Michael, you will not be dead because I know you well and you have the immune system of an ox. Okay, and you could survive 10. You could survive 10. Oh, what happened to you in COVID? What happened?
Well, I almost died, but of boredom.
Right.
I caught COVID. I started sneezing one night. I remember I was in another MP's car, actually, and I was sneezing.
Are you sure that's why you were sneezing, Michael? What did you have up your nose?
No, I've never done that.
Glad to hear it.
No, I won't say what I have done, but I've never snorted anything apart from anti-runny nose mixtures that you do.
Vicks.
Anyway, all perfectly legal.
You've snorted Vic.
But the point, yes, exactly, Vic. I've always wanted people to rub Vic into my chest, but that's another story. But I just had a runny nose for one day, and I kept proving to be positive for 10 days, I think it was,
Ridiculous.
or 11 days. And in the end, I was still testing positive, but they said after, I can't remember what it was, 10 or 12 days, you know, you're now free of it. But yeah.
I mean, so Michael, I'm so glad that you've put that in context. Simon in Leicester has sent me a devastating message about how his mother was 65, worked in a care home, had no underlying health conditions. She fell ill, was taken to hospital and died without her loved ones around her. Movingly, Simon said, I had to say goodbye to her on the phone. It was early in the pandemic and the health service and government were still trying to understand how to deal with it. It's easy to pass blame around in hindsight. All I know, says Simon, is my mum isn't there. So Simon, my heart goes out to you. That is devastating. And of course, Michael, the virus took too many people from us, but it remains my view, Michael, and you are actually a qualified doctor, it remains my view, tell me if I'm wrong, that I think we overreacted to this virus, that yes, it was nasty, it could be fatal, but it was predominantly non-fatal to the vast majority of the population. If you look at the damage we've done with lockdowns, it's far worse.
Yeah. I mean, all this is, as I said, with hindsight, a very close friend
Is
of
that
mine who
true? I mean, Sir Michael, we knew that COVID was mild pretty much from day one.
Well, no, we didn't, you see, because if you remember, the situation in Italy was that their health service was overwhelmed and people were dying on gurneys, on trolleys, not even in corridors, but actually outside, I suppose, thanks to better weather in Italy. No, I mean, and that was the fear that we had. But I was just going to say, a very dear friend of mine, whom you know, I won't say his name, his mother also died of COVID in hospital. And the terrible thing was he couldn't say goodbye to her. At the end, his father was able to go in and say goodbye to her through a glass screen.
Yes.
But, my friend was unable to do that, and I think it's scarred him. So there were so many tragedies, like your last caller, like your last messenger said.
Well,
and that was so terrible.
Most definitely, Sir Michael. Let's take this voice note from Wayne. Take it away, Wayne.
Good morning, Mark. So from day one, I never believed the pandemic. I looked at all the science, including the science that was slowly getting cancelled time after time. And I realised early on it was going to be a war of stats, the stats that were going to be manipulated to justify a means. A prime example is my son had to go in for a very important operation during the pandemic. They swabbed him as we went on the ward for COVID. I then said to the nurse, well, hang on a minute, are you not going to swab us as parents because I was going to be staying with him? Oh, no, just the patients. I found that a bit weird. And I said to him, so what happens if he tests positive? Do we not have the operation? Oh, no, he still has the operation. It's just we treat him as a COVID patient. So I said, hang on a minute, so he's coming in for a stomach operation. Yes, but his notes are going to say he's actually in as a COVID patient. Yes. So even though he'll stay for 3 days and then go home, he's going to, that 3-day stay is going to be classed as a COVID patient. And she said, yes. This is the statistical madness.
Wayne, madness is the word, and that is, to a degree, Wayne, a fraud on the country, a fraud on the public, really. And we had people that were unfortunately being run over by buses, and they were classified as a COVID fatality. So, Michael, this from Andy in Norfolk. Hi, Mark. What did I sacrifice during COVID? Well, I nearly sacrificed my sanity. I run a fishery. They allowed people to go fishing, but only during the day. No night fishing. Andy goes on to ask, was COVID more prominent at night? I kid you not, this actually happened, and finally made me realise that so much was wrong and largely unnecessary about the COVID control measures. And we saw, Sir Michael, didn't we? A lady arrested on a park bench at the seaside drinking a coffee on her own. We overreacted, we panicked, and we made too many mistakes.
And the Derbyshire police, I remember, had drones up.
Yes.
People were walking in the Peak District, totally separated, but walking in the Peak District with cardboard cups of coffee,
yeah,
or thermos flask with a backpack, and they were arrested. And there's absolutely nothing to suggest that, from an epidemiological point of view, that they would have transmitted the disease to one another or to others. I have to say the Staffordshire police, and especially in Lichfield, because I spent most of my time in Lichfield. I didn't go down to London. And in fact, all our voting was done remotely. And if I can tell you one incident, they started doing it where you could vote remotely. And Rishi Sunak, who was then Chancellor of the Exchequer, actually voted against one of his own pieces of legislation. He'd given his phone to a SPAD who couldn't remember, a special advisor, who couldn't remember whether he was supposed to be voting yes or no. So after that, we did it by proxy. So we would say to the chief whip, you can vote on our behalf. And there were a couple of occasions when I voted against the government on certain things, and fairness to the chief whip at the time, he did actually cast my vote in the right direction, so he was trustworthy. But I always remember the embarrassment of Rishi Sunak having voted against his own piece of Treasury legislation by accident.
Now, this show, Sir Michael, is all about opinions. I've got a very important text from Jen who says, Mark, I'd like to correct you as you keep saying that COVID primarily affected elderly people and you're implying that they could be sacrificed. In fact, there were hundreds and thousands of youngish people like me who were forced to shield because we have health conditions. In my case, it was an autoimmune disorder, an autoimmune disease. I actually got COVID for the first time in 2022 after lockdowns and was very ill with it. Jen, thank you for that. And thank you for sharing your views, which go against what I've said about the idea that it predominantly impacted the elderly and the infirm. Sue says, Mark, this inquiry has not addressed any real issues and has taken too long. The biggest fallout from it is the mental health issues with the younger generation who were not at school. It ruined their lives. What did I sacrifice during lockdown? My job, says Sue. I was laid off. And that's devastating, isn't it, Michael? We've now got this legacy, an 8 million long NHS waiting list, £2 trillion worth of national debt, a generation of damaged and diminished kids, and a mental health tsunami. Before I let you go, do you not think, Sir Michael, that the Conservative response under the last administration of which you were a part would have been to go down the Sweden route, tell people the risks of the virus and let them make a judgment accordingly?
Well, again, with the benefit of hindsight, the answer is yes. Can I just correct you on one thing before we both get arrested?
Sure.
I didn't do the clinical side of after doing a medical course, medical degree. So I'm not a doctor. And
no, but you've been. I'm glad you pointed that out. How far did you get with your degree, with your medical degree?
You know what? This is a tragedy. My parents thought I was mad. I did it for 4.5 years. And I suppose I could have done my Bachelor of Medicine and Bachelor of Surgery after doing another 6 months, but I just knew that the NHS was not for me. A lot of my friends went off to Canada and Australia, but I decided I would go.
Well, you're nearly a doctor.
I did.
You're nearly a doctor.
Nearly a doctor.
Oh, well, listen, you can...
A quack.
Let me tell you, Michael, you can examine me anytime you like. But just briefly, it wasn't a Conservative response to the pandemic, was it? If you'd had a Conservative... If the party had stayed with its values, you mentioned hindsight. Well, we knew weeks into the first lockdown that there was enormous damage and that this virus looked like it wasn't going to be controlled. And you could look to Sweden. So maybe I'll let you have the first lockdown, but why the second and the third?
Yeah. And do you remember, though, we kept saying, follow the science, follow the science. And as one of your callers said, the science kept changing. And you had people doing modelling. Imperial College London, which has got a very good medical school, by the way, did modelling and said there would be hundreds, tens of millions of Brits dying from COVID. They got that seriously wrong. The science was guesswork, just like, incidentally, this report, which says, 23,000 people died unnecessary, is another bit of modelling, and modelling is never accurate.
My thanks to the fully qualified medical doctor and surgeon, Sir Michael Fabricant. Michael, we'll catch up soon. I'm only kidding. Of course, what he is a respected public figure and the popular former MP for Lichfield. Michael will join us again in the near future.